Kate Perkins here again from Cancer Rehabilitation and Lymphatic Solutions and the founder of the Bounce Back from Breast Cancer program. Welcome back for another episode of Talking with the Experts. We're up to episode 9. So today is a bit of a tech talk. And so as you know, I like to talk about products that are used here in the clinic that I find very effective in the treatment for my patients. And I love to talk about techniques and share those with you as well. So if you are someone who has been diagnosed with breast cancer or recovering, or you're a practitioner, a lymphedema therapist, a GP or a specialist, this episode is for you. And today we're going to be talking about compression pumps, aka sequential intermittent pneumatic compression, SIPC for short. And so today we're going to be talking to Jen Sanderson. So welcome, Jen.
G'day, Kate.
So Jen is a physiotherapist and lymphedema therapist. She's almost finished her PhD, which looks at using, correct me if I'm wrong, Jen, ultrasound to screen or work out the lymphatic or lymphedema tissue composition.
Yeah, so we used high frequency ultrasound and ultrasound elastography, which kind of gives you a pattern, a color overlay over the image to assess lymphedema. So we looked at a whole lot of assessment tools, and that was one component of it.
Okay, wow. So as a practitioner, I can't wait for that paper to come out and check that out. So Jen has also worked in the public hospital arena as well as private practice, and she has her own private practice in Brisbane, Queensland. So we'll put Jen's details up at the end of this recording as well. So if you're in Brisbane and you need a lymphedema therapist, I can direct you to Jen.
Great.
So, okay, so let's get on and talk about compression pumps. I'm going to call it compression pumps because SIPC is way too long and it's a mouthful. So in my clinic, I use compression pumps for women to help, for anyone, men and women. And today in particular, we'll talk about the upper limb and the trunk. And so I use compression pumps for what's called the reduction phase to help reduce lymphatic volume in an arm. And also to use the compression pump as a maintenance tool. So Jen, first of all, can you tell us what a compression pump is?
Yes, so before I start, I also work for MediRent as a clinical advisor and clinical support.
Sorry, I left that out. Yep, thank you very much.
Just to be upfront, so yes, I've got a therapist background, but I also work for that company with clinical support. And they distribute compression pumps. So that's how Kate's kind of linked in with me for this session.
And I use MediRent pumps here in the clinic, and they're absolutely amazing. But we just want to generalize and talk about what compression pumps are. So take it away, Jen.
So compression pumps are essentially a control pump or a control box that's attached to inflatable garments. So what the pump will do is pump air into the inflatable garments, and when the air is filling up into the garment, it then exerts a pressure on the limb or the area that's covered by the garment. The way that it works is similar to what we're trying to do with compression sleeves or compression garments in bandaging, where you're trying to squeeze the limb and push the excess fluid that's within the tissue space towards your lymphatic vessels and your veins in order to so that then your body can pick up the extra fluid and move it through its normal processes. So it's just trying to assist that movement of excess free fluid out of the limbs and body areas.
So is there any preparation that a person needs to do prior to using a pump?
Not really. It does depend on the person though, and the area that's covered by the garment. So if you have someone that their lymphatic system is compromised for their limb as well as their trunk, but you're only covering like an arm sleeve garment, so the air chambers are going to cover to here, but you do still have your trunk being compromised in terms of lymphatic flow, you would certainly be doing some kind of manual lymphatic drainage whilst the pump is running or prior to the pump running in order to help the system move the fluid through. Essentially, you could just, if you had an arm vest or your main problem is on the arm, you can get away with just applying the garment on there, but it's really good practice to actually be checking around and feeling and doing when you're doing your manual lymphatic drainage so that you can see where other problems may be occurring so you can deal with it straight away. So there's no specific kind of pre-treatment that you need to do, but it'd be really good practice just to have a feel around before and after so that then you can work out what you need to do for you, and that's where your lymphedema practitioners will come in really helpful too.
Yeah, absolutely. So I find that using the pump as a reduction phase is a form of reducing that lymphatic volume before I go ahead and measure for a garment. I also use other night garments as well to go underneath the pump to facilitate that that reduction and soften that tissue. Are you able to explain to the viewers a little bit more detail in that technique?
So probably the best way to talk through how different therapists and patients will use it is bring it back to the different stages of lymphedema. So there, at the very start, you have someone that is at risk of developing lymphedema, and they may be experiencing those initial signs and symptoms. So, you know, you're aching, heaviness, even seeing like localized swelling that kind of comes up, but then it fluctuates and goes away. Even in that early stage, people will use the pump and they would be using it really just to get on top of the excess free fluid. So they may use it for short periods of time or a short period of time just to get back on top of it and bring the limb down to the same volume that it was prior to that, that overload. Then, so that's your early stage people where they're just starting to get a few symptoms. In the kind of the next phase is kind of your maintenance phase lymphedema patients, which, you know, they have the lymphedema, the volume has kind of gone past returning back down to the size that it was before, but they're maintained quite well. So that's where, as you said, you may use the pump actually to either bring down the excess fluid prior to measuring for a garment, and that helps limit your kind of garment creep. So year after year, just needing a little bit bigger size because the limb is just gradually gaining more fluid over time. So the pump can kind of get that excess fluid down so that you can get into the same size that you were before. You're just getting a new garment. But you also may use it for just your home maintenance. So using the pump as part of your strategies to maintain your limb volume. So with that group, it really depends on the presentation as to how frequently that you're using it, what your aims for treatment are. But in terms of maintenance, you may be, like, for example, using it daily or second daily to maintain or continue to maintain the volume where it's at, or using it more frequently if there's a little bit of an exacerbation. So the next phase would be someone that has lymphedema and then they've gone into an exacerbation. So whether it's cellulitis or heat related, activity related, something's kind of set off the volume. Then you may use the pump, as you said, for a reduction phase. So that's where you're really aiming to try and bring volume down. You're trying to soften up texture and just bring the limb or the area that's covered by the garment or affected by the lymphedema to its best volume and to its best texture, so that then it can be maintained. So you're going back to your maintenance phase. So it really depends on where you're at throughout those lymphedema phases as to where you were implementing the pump. There's certainly room for it everywhere, like all of those different locations, but it really depends what's most appropriate for you and what fits within your daily routine and what the aim of the treatment is. So you certainly don't need to be sitting on the pump for hours at a time if you're very low risk, haven't really got any symptoms, and you're not symptomatic anymore. So making it appropriate for your presentation is important too.
And so talking about time and time spent using a pump, what is the recommended time period? And there's different speeds of the pump. So what are your recommendations, or, generalized recommendations?
Yeah. So in terms of time, because the lymphatic system works at a slow rate, it wouldn't, so essentially you can't speed up, like you can speed up the lymphatic uptake and the amount of fluid that goes into the lymphatic vessels and the veins, but your body's own processing of that fluid will remain the same or only slightly elevated with the use of the pump. So it's really important that you actually have long treatment times on the pump. The recommendation is 60 minutes for a pump session. And the reason for that is that gives you enough time for the pump to squeeze the fluid and help move it into those vessels, but also to move edema that hasn't made it into the vessels up proximally into the limb or onto the chest wall, so that other lymphatic vessels are able to pick it up and move it on. What you'll find with short treatment times, particularly if there's it's a large limb or there's a lot of free fluid there, so say we put it on for 30 minutes, you'll find that the limb will refill really quickly. So it'll feel like the pump effect isn't lasting quite as long as what it would with a longer treatment. So immediately after having a pump treatment, you should feel like something's changed. So the limb feels lighter, the contour has changed, or like it simply feels like it's changed and improved. And that should last at least a few hours, or at least until the next pump session, to know that you've got the right amount of time. But also that is related to your pressure as well. So the different settings that you've got on the pumps, apart from time, are pressure, mode, and the duration. So if you have a pressure that's too low, you can get the same effect in terms of the limb refilling quite quickly, because the pressure just hasn't been firm enough to push it through. And so that's something to be aware of as well. So that's pressure, time, your speed. So speed is related to the compression and pause phases of the treatment cycle. So if you've got, so we'll just say that is just an arm sleeve on, and it compresses, so it will fill, or the inflation phase is filling all of these air chambers up to the top. It will hold for a short period of time, and then all of the air chambers will deflate for a short period of time and then inflate again. So you're going through compression and pause. With a fast speed, you have, so that's a speed of 6 on the LX9 device, you'll have the air chambers will fill, it'll hold for about 2 seconds, and then it will deflate for about 6 seconds, and then it'll start compressing again. With a slower speed, you're looking at all of the air chambers inflating, holding for a much longer period of time, so up to 12 seconds, in addition to your fill time. And then it will go through a rest phase, which is about 15 seconds on a slower speed. So you've got a longer compression phase and a longer rest phase with that slower speed. So to be able to work out what's best for you is actually, it really is the individual. So if you feel like you need a longer time frame between inflations or between compressions, then you go a slower speed. If you feel like you need a shorter amount of time between the inflations, then you go a faster
Okay.
towards 6. So there's not a great deal of research around the different speeds and what, in terms of effectiveness, what the difference is. It really is comfort and how it feels for the patient.
Okay, so we've talked about speed, pressure, time of length of time having the garment on. There's different modes. Can you explain the different modes to us?
Yeah, so what the modes actually relate to is the sequence with which the air chambers will inflate and deflate. So on the LX9 device and other devices that are on the market, they'll have multiple modes, or they may only have one mode. I will start with B mode, because that's the one that if there's no other modes on it, it will most likely be B mode that they are running it. So B mode on the LX9 device is a sequential mode, so a sequential fill pattern. So it will fill from the hand all the way up, like in sequence, up to the shoulder or across the chest wall, hold for a period of time, and then deflate, and then just start that cycle again. So it's directing the fluid up and through. With that mode, it is the most effective in moving bulk free fluid. So if there's any free fluid there, or the daily fluctuations of edema, that's the mode that's going to shift it through. If you're in a clinic, most often that B mode is going to be the most effective for you as well, because you've got the coverage of the garment is getting filled each sequence, and it's just more effective in increasing your lymphatic return, but also your venous return. So if we go back to A mode, so A mode is a pre-therapy mode, and the way that it works is that it kind of clears the way ahead as the air chambers fill. So it will fill the top, move the fluid up, fill the plate, and then fill again, moving through. So it's clearing the way ahead as you go.
So it's like doing a manual lymph drainage, self-manual lymph drainage, and starting from the elbow and clearing that pathway before you start at the hand. So same principle.
That's it. That's exactly right. And the reason that you would use it is it's going to be most effective for people that have got more proximal edema. So edema more up around the upper arm and shoulder, into the axilla or on the chest wall, because that fluid is kind of blocking the flow for your hand and forearm to get through.
Yeah.
So that's where pre-therapy is going to be most beneficial for you.
Okay. And so the pressure, does that need to be more or less when you're talking about starting with the A mode?
No, essentially you could stay on the same mode, the same pressure throughout the different modes, because there's a sequential sequence or fill pattern at the end of each. So with its pre-therapy, it'll then run that sequential pattern. Your comfort levels need to be comfortable for that sequential fill, because all of your air chambers are filling up and holding, and then starting that pattern again. So as long as you're comfortable with that sequential fill, or whatever you're on B mode, then you'll be comfortable with these other modes. Okay. So if you're at 40, then you're comfortable there, then you just run it at 40.
Okay. And talking about pressure, so is there a recommended limit to when you're doing upper limb and trunk for pressure? So
most people are comfortable around the 40 millimeters of mercury. It depends on their sensitivity as well, like tissue sensitivity, and that can change over time as well. So they may start on a lower pressure, ensuring that it's comfortable for them, and then build up the pressure. Basically, you would increase or change pressure based on comfort. So how comfortable it feels for the whole treatment session. So if you've got it on for an hour, it needs to be comfortable for that whole time. You can't get to 50 minutes and just kind of struggle through the last 10 minutes.
Yeah.
Because if you're uncomfortable, your body just resists fluid evacuation. So that's your muscles as well as your vessels just aren't going to be conducive to fluid flow. So comfort is important. And then effect. So after you have the pump session, something should have changed. So it feels lighter, the contours changed, it just feels like something, an improvement has happened after the pump treatment session. If it hasn't, then that's where you're looking at maybe increasing your pressure or increasing the duration, depending on where you're at. So pressure is key to actually getting enough squeeze to move it through.
Okay.
So
Mode C?
So we've jumped off on a tangent. So if we go back to the last two modes, so we've got mode C, which is the distal intensive mode. So this is where you have the hand chamber or the foot chamber will inflate 4 times. So inflate, deflate 4 times, and then it will run through a sequential fill. That really is for targeting your hand. D mode is a wave type mode, so it will fill 1 to 2 chambers at a time, and they kind of move along like a peristaltic wave, so up the arm, and then again we'll run a sequential fill with all of the air chambers inflating. With any of those targeted modes, so anything other than B mode, you're going to get the best effect if you're using them for a shorter amount of time. So as in, a fortnight or alternate treatments with your B mode. So B mode is going to be your most effective in moving fluid through. Your other modes need to be thought of as targeted modes, because they do reduce how much compression that you're getting through the rest of the limb where the air chambers aren't inflating as often.
Okay. And with D mode, can you have that on for longer if you don't do it in conjunction with B mode?
Yeah, you can. So you would run those targeted modes for like the hour session. So even with A mode, you can put that on for an hour. It will run through its pre-therapy, and then the pattern will change over automatically to a sequential fill. So you're not needing to run pre-therapy for 15 minutes and then change the mode on the device. The device will do it for you. It's the same with your C and D. You can run all of those just for the treatment session. It's more, I think the point that I'm trying to make is that your B mode or your sequential fill is what's going to be the most effective in moving free fluid throughout the whole area that the garment is covered. So that's where your lymphedema practitioners will be coming in. If you're looking at a targeted mode, you'd also be looking at foam inserts or taping, or you're doing other strategies as well as the pump helping with it.
Great segue into the other strategy. So I've had, just for example, a lady who has had breast cancer related lymphedema on her affected side, and she had become quite disillusioned with treatment and was letting her arm go. Doesn't cope with the normal day-to-day compression. But I got her into a nighttime garment, which provides some extra massage in conjunction, tissue softening in conjunction with a compression pump. And so she had an LDEX score, initial LDEX score of 64, which is
really high.
Way out of the normal range. The normal range is between -10 and +10. Got her into using a compression pump for that reduction phase, plus a nighttime garment. It has softened her tissue quite considerably. And she's back to pretty much wearing her normal day-to-day clothing as well. So her LDEX is now down to 25. Which is a massive reduction. We've sort of plateaued at the moment, but that's what she's comfortable with, because she's not comfortable with wearing a normal day-to-day compression. So it's worked magnificently for her. And so she uses the pump towards the end of a day. Is there any recommendation at the time of day, or is that just personal preference?
You're going to get the most benefit when you've got the most edema there. So which for most people is the end of the day or after particular activities. Initially, when you start with implementing the pump into your management strategies, it's actually worthwhile, even if the limb is really well maintained, is actually trying to do a bit of a reduction phase with the pump anyway. So trying to do increased frequency and long duration sessions to see firstly whether you can bring the volume down, so you know where your plateau is to start off with, or what your maintenance phase size will be, and then reviewing how your symptoms go over the day. So for a lot of people it's end of day, and that's where if you're only going to do one session in a day, you're better off doing it at the end of the day, because then when you're sleeping, that's when your lymphatic system works at its best. So you're kind of setting it up for success, and in the morning you should have a better starting point, type of thing. So it does depend on the individual and what you're aiming for, but that end of day is kind of a common time to do it.
Yep. Okay. And if someone puts their pressure up too high, can that have the opposite effect in constricting the lymphatics?
Yeah, so it actually, when you're uncomfortable, the way that your posture is and the way that your muscles are and the way that you breathe, so all of these things will help with lymphatic flow. If those are then tight because you're uncomfortable, for lack of a better word, that then just resists fluid evacuation out of the limb. So it's just, not only are you uncomfortable, you're also then not going to get the effect that you want. So most people with the pressure will be, but like for most of my patients would be between 40 and 60 millimeters of mercury. They feel comfortable there. It's effective. They're getting a response that's lasting until their next pump session, and they're maintaining well on that. The people that are on a higher pressure are more, have larger severity limbs, or there's a lot of textural change through there. And yes, the pump can help with softening, but that's where you really need your lymphedema practitioner to help with those softening techniques. So as you said, using a night garment, but also just hands-on getting in there and softening it up. And then the pump can help with moving your free fluid then. Regularly the arm pressures would be between 40 and 60, unless you've got a whole lot of stuff going on. But it certainly needs to be increased or changed in discussion with your lymphedema therapist, so that they can just work out what's going on, type of thing.
Yep. Absolutely. So I've also recently had another patient in whose lymphedema symptoms have just been exacerbated a little bit. She's going through another cycle of chemo. So her body fluid has increased, so her lymphedema symptoms have increased. She's recently, or just in this year, finished radiation treatment. So now she's getting some radiation fibrosis, and a bit of breast edema as well. So I have put her into a biocompression garment, the chest and arm combination, which she is raving about and is absolutely loving. Can you tell us how the chest and arm combo works?
Yeah, so those, the arm vest garment with biocompression has air chambers that kind of direct the fluid up to the shoulder and then come across the chest wall. So front and back will come across the chest wall. The great thing, so, and this is about pumps in general, not just specific, but as you had mentioned with the radiation fibrosis, a lot of fibrosis and the fatty change that can, or deposition that can happen with lymphedema, is associated with inflammatory mediators within the tissue layers. So within your top dermal and subcutaneous tissue layers above where the muscle is. And the way that the pump works is not only by increasing your venous return and your lymphatic uptake to get the free fluid out, but it also helps replenish that extracellular matrix. So that's the fluid that's between the cells that is responsible for delivering nutrients, and that's where your inflammatory mediators sit. So by pumping and helping clear those inflammatory mediators, it actually can help with reducing the amount of fibrosis that does develop through there. The biocompression arm vest is really lovely. It has a really lovely kind of squeeze and push effect. So it really feels effective as it's actually moving along, but in a comfortable way. Yeah, I've lost track of what I think I went off on a tangent.
That's perfect. That's fine. Cut. Okay, I'll start again. So the chambers in the vest component, they actually are vertical, so they move across the chest. Which
yeah. So if you had it on this arm, you're coming across this way. And a lot of the ICG type work that's going on at the moment is saying that your vessel uptake and directions out of the quadrant is actually coming over to the other side, and they're not really seeing drainage pathways going downwards.
Yeah.
Having said that, though, we do have a arm vest product that does have air chambers that go the other direction, so that do go down, and that is partly for the option for people that may be at risk on both sides. So you don't want bringing fluid across to the opposite side if you're then putting that side at a greater risk of developing swelling as well. So your better option would be to drain downwards.
So that there is obviously still a place for that type of garment, and that where the chambers are.
Yeah, well, and so what you think about with fluid, the way that it's getting into those being able to be processed by your body is just entering lymphatic vessels. So you've got those little initial lymphatics that are everywhere. So they're all over your skin. So you essentially what the pump is doing is trying to move the fluid away from an area where it's already overloaded and the vessels can't take up anything else, to an area where vessels can pick up the fluid and move it along. And I certainly find with my own treatments, I actually do a lot of stuff around ribs and around, so I'm not necessarily taking fluid down, I'm kind of trying to mobilize and manipulate around the region around the quadrant.
Yeah, so because you can get that fibrosis in that intercostal area that you want to move.
Yeah.
The other thing I wanted to ask, so what about if women have implants, they've had reconstruction, can they still use, is it still safe to use the vest arm combo?
Yeah, so you can use so it's safe to use the pumps over the top of implants, and even your tissue expanders. And you tend to find that swelling, like initially, you will have swelling through there anyway. So the compression pump and the vest compression will help with clearing that fluid through. The key is comfort though. So the recommended guide on a starting pressure is 40 millimeters of mercury. For someone that has only recently had the implants or tissue expanders put in, you might be starting actually at 20 or 30 millimeters of mercury. So just making sure that you're comfortable, so that then the body will be picking the fluid up and more conducive to flow.
Yeah. Okay. I think that I have one more question. Can people use the normal day-to-day compression, so under compression pump?
Yeah, so you can. However, especially with arm sleeves, you tend to find that you have little indentations at the end of the day, so around the top band or around the wrist or around the hand. If you're going to pump over the top of the garment, you'll find that those little indentations are only going to be encouraged and reinforced by the pump, because you're getting external pressure over the top of it. The times that you may pump over the top of it might be if you're trying to put an extra session in over the day, and it's too difficult to kind of don and doff the garment. You can certainly put the pump over the top of it, but then either later that night or the next session, you'd be pumping without the garment on there, so that then you're not still encouraging those same indentations through there. So kind of a mixture. You can definitely do it, but you wouldn't do it all the time.
Okay.
Because you'll end up with just kind of filling all issues around where those bands are.
Yep. So coming into summer, it's getting much hotter, and obviously we experienced that kind of heat over the weekend, and lymphedema symptoms can be exacerbated. I tend to assist those patients by recommending they use a compression pump through the summer periods. Why is it that compression pump through those summer periods helps that extra swelling through the summer periods? Like, why is that extra increase in fluid occurring when it's hot?
Yeah, so when you're hot, you have more blood flow to the skin surface to try and cool you down, and with blood flow is your lymphatic exchange. So you've got more lymphatic fluid that needs to be picked up because there's more fluid flow and exchange of fluids in the tissue space. So there's more opportunity for there to be overload within the tissues. The way that the pump is helping that is essentially just helping squeeze the extracellular matrix and that excess fluid back towards your vessels to help move it through. So it's just really assisting you in the return, so venous return as well as lymphatic return. So during those hot days and during the summer periods, it's a really good just assister in trying to bring things down or maintain you, so that you're not then blowing out where you need to go through your bandaging. So it's kind of that being proactive about it, particularly if you do find that you react really strongly to heat.
Yeah, absolutely. I think we've covered a fair bit in this short session, and absolutely beneficial for patients, therapists, GPs and specialists alike. Is there anything that I have missed that you think is an important message to get across with regards to compression pumps?
Oh, I don't know. I think probably the main thing is that you're finding the right product for you and the right garment coverage for you. So earlier we were talking about using the arm vest for people where they've got lymphatic compromise throughout the chest wall and the arm. The arm vest isn't right for everyone. So there's plenty of people that just use the arm sleeve and then they do their own manual lymphatic drainage, or we've even got a vest, so it doesn't include the sleeve. So for people that haven't had axillary dissections, they may have had sentinel nodes, but they've got significant issues around either from the breast conserving surgery or just through the surgical intervention or through radiation, where they just want to target the chest wall. So that product would be more appropriate or more comfortable and more targeted for them. So there isn't really a recipe treatment or a recipe product for people, and it can be confusing when you're looking through all of the pumps on the market and the different garments. So it's certainly worthwhile, having the conversation with the lymphedema practitioners, and the one that knows your medical history and knows your presentation and how it's changed over time is really important, because that will help them guide what your device settings are going to be, but also what's the aim of treatment. So we're for example, going through a reduction phase and then we're looking to maintain, or, during summer you need help and this is a good way to help you. So you're just using the pump during summertime and then you go back to your normal maintenance. The last important thing is that your pump doesn't replace your other treatments. So if you're implementing the pump into your treatment strategies and all of the different tools that you got, you continue all of those. So you still do your massage. You may change it a little bit, but you're still doing your massage. You're still doing breathing. You're still doing the exercises and strength work. So whatever's guided by your therapist, and the pump is in addition to that. It doesn't replace all of those things. And we know that from research, the pump alone is not as good as everything.
All those combined, yeah.
We need it combined.
Yep. So for my listeners and viewers, if you haven't had the discussion yet with your practitioner and you want to know more, go to your lymphedema therapist and ask about the compression pump and ask if it's going to be suitable for you. If you're already using a compression pump and you're finding that it may not be working as well, go to your therapist and talk about options. Don't be afraid to ask, is what I'm saying, is because, you know, don't get stuck if you don't feel it's working for you. That you just may need to change the pressure or the speed or how long you're actually using the garment for. So Jen, thanks very much for being our expert today.
No problem. Thank you for having me. It's been a pleasure.
Thank you so much, and we'll talk again soon. Bye for now.